So, Jonathan, while we're getting set up and everything, can you tell the attendees here a little bit about the pain that you have?
Yeah, so I usually have a lot of like dull, achy pain here and right about here. And as the day goes on, it'll tend to get tighter and more achy, and I'll have to stretch it out and get some massage. That usually helps, but that's pretty much the main pain that I feel.
So, is that typically possible with decent anatomy is to use one entry point?
Oh yeah, all the time, because we're doing the 4-inch needle, so I'll usually go in for one entry point, and the less times you have to poke through the skin, the more it decreases your chance of infection or anything like that. So I'll usually go in, hit the first one, pull out, go to the next one, and then the next one, so you can get that much range.
Patients like a little bit better too.
They do way
So
less
it's only one stick, as opposed. So if we were going to do 3, 4, 5, we would end up doing one injection for 3, one injection for 4, one injection for 5, another injection for 3, another injection for 4, another injection for 5. So you do end up doing 6 sticks, as opposed to 2. Lumbar ligament. Lumbar ligament. I don't see any big issues there.
No, sometimes I see like the black, like fluid. Sometimes I see some cortical changes as it attaches.
Mm-hmm. I don't see anything exciting there.
Okay.
And then for everybody, I naturally will flip the probe for you, so it always looks the same, right? So sometimes when you're like reading other people's review, other people's studies and stuff like that, they won't naturally flip it. So it should go always to the patient's right. So this is what your right side is going to look like. So see how the slope is coming this direction, like their bony landmarks, and then this will be what your other side looks like. This is what the left side looks like.
That's not bad.
I don't really see anything on here either. What I will do is I'll show you this, and then I'll show you that. So what you can actually do is you can put them right next to each other, and you can compare them. Right? It's an easier comparison as opposed to trying to take a look at one side that looks like this, and another side looks like this. And be like, okay, does the thumb look right? Does the thumb look right? Okay, so the index. I just show them to you so you could actually superimpose them, and you could actually see those and see a whole lot there. Let's go ahead and take a look at SI joint. So SI joint, right? Find your spinous process. Spinous process, lamina facet. That's 4. That was 5. I'm going to walk it down until it's flat, right? So see how I have a flat sacrum, and then I'm going to walk over. Have enough gel. Walk over. This would be my right side SI joint. So PSIS, sacrum, SI joint. Any big issues here.
I'll let you turn it on.
Actually flip. So I go to flat, I work my way across. There's my SI joint here, short axis. SI joint long axis. No big issues here either.
We'll just put the whole volley.
Dr. Soul, can you explain what we're going to be injecting?
So we have a combination of the Wharton's jelly, the exosomes, and PRP. Total volume of 10 cc's. I'm going to be putting 2 cc's bilaterally at 4, 5, and 5, 1, and then 1 cc bilaterally at 3, 4.
So, just for everybody, like after a while you can do this, you can just throw it down and you know where you're at. If you're not at that point, start on spinous process. Basically spinous process in the center of it. Bring your facet into the center of your screen. Everybody see where the facet is? Just the right of that arrow. And then turn on. And you'll have 3 where the arrow is, 4, and 5 is deep. And then this will happen, right? So I try to brag, try to show off. I got lost. This happens all the time, right? So what do? Go back to a home, right? Go back to a spot where you know for sure you are, right? There's my facet. Come over. My facet on that side in the center. Come down. 3, 4, 5, S1.
Jonathan, big breath in for me. And all the way out when you're ready.
So you're going down to the first one. There's
Yep,
5 first.
Yep, 5 in right there.
Okay.
You can see it.
Everybody see her at 5? The bright white dot, the line that's coming down. Okay, so we're going back. There's 4.
You're doing amazing.
A little flatter.
I don't think it's past.
Yep, you're there.
I can see.
Mm-hmm. Yep, whenever you're ready.
Beauty, that side's done. You okay?
Yep. Going around in there.
Yeah, it feels weird. But better to do that than to pierce the skin multiple times. It's
Oh, yeah.
faster.
Yeah.
You're just in and you're moving.
Good job. So there's 3, 4, 5.
Amazing. All right, you're gonna do that big breath in for me again, and out when you're ready.
Put that out right there.
There we go. Slit her right against it. That looks spacey.
Yeah, there. This one is a little bit more.
Seems like this one's not good.
You did
What
great.
else?
That side felt more fibrotic.
Yeah.
The tissue felt very
It
crunchy.
looked a little thinner too.
Yeah, you did a lot more loss on that.